Oh, do you hear me? Okay, great. Hello, good morning, everyone. Thank you for having us here at the World Summit AI. So let me start by a survey, a quick survey among you. Who among you knows someone or is already has already had an organ transplant or is on a waiting list? So I see 1, 2, 3, 4. Okay, how many of you know anything about organ donation and transplantation? Okay, a little more. Oh, good results. All right. Well, for those who don't know anything, next week is National Organ and Tissue Donation Awareness Week. So I'll give you a little head start about organ donation in Canada and also elsewhere, and we can provide more information on what AI is doing. So let's start with a few facts on organ donation. 10% of the global population suffers from a kidney disease, a chronic kidney disease, of which about 10 to 20 million people will at some point need an organ donation to, we have a technical issue, okay, to continue living correctly. And every day in the US, so in the US only, there are 17 people dying because they haven't found an organ replacement. Over a year, that's 5,000 people. It's a village. Also, just to make things a little gloomy and perhaps a little more personal, you are 5 times more likely to be in need of an organ donation than to actually donate one. And why is that? Well, first, there's shortage of organ donors. There's a human factor there. And the other one, well, the system itself is a bit outdated. We'll discuss it, how we can help there. Scarcity of organs can be resolved in a simple way, and you, as a person, as a citizen, can contribute with very little impact on your everyday life, because it only takes 2 minutes to register as an organ donor, and a little more to discuss about it with your family. Because should you die unexpectedly, which I hope won't happen anytime soon, but should you die unexpectedly and you'll be registered as an organ donor, your life could save up to 8 other lives. This is called the gift of life in organ donation. So that's the human part of it. Now let's go into the more systemic issue. One of the main challenges here is that organ allocation, which aims at finding a potential match between an organ donor and someone who is in need of an organ, a recipient, is executed with outdated systems. As this recent article from the Washington Post says about the US system, too many organs are discarded, damaged in transit, or simply not collected. Faulty technology sometimes jeopardizes transplants, and poor performers face little accountability. That's in the US, but we face similar issues in many other developed countries. Why is that? Because organ allocation is mostly rule-based, which creates a one-size-fits-all process that serves you well when you're part of a majority demographic group, but becomes less than optimized when your population becomes a little more diverse. Also, coordination between the various stakeholders is often very manual, so time-consuming. And finally, organ allocation is not informed by current and emerging evidence. Because of this, many countries are working on transforming their systems, and AI can bring something there. This is where we intervene. At BIEX Health, we are building a solution supported by AI to help organizations that coordinate organ donation. So for example, in Quebec, it would be Transplant Québec, in Ontario, Trillium Gift of Life. For those who are from the US, it's UNOS, which are looking to optimize organ allocation and to increase long-term transplant success rates. It is cloud-based to allow for real-time matchmaking and notification to various stakeholders. It uses machine learning to create personalized matchmaking, but also personalized prediction to help patients and their medical team take the appropriate decision. And it integrates the best data sharing standards, interoperability standards, to facilitate the exchange of health data between the solution and other existing systems. As more countries are working on improving the long-term outcomes and the everyday lives of people in need of a new organs, with the support of AI, we want to support them in making organ allocation better and in providing patient and medical teams with enhanced clinical decision-making tools. In 1994, the World Marrow Donor Association was set up to promote global collaboration and best practices for the benefit of blood stem cells donors, and transplant patients. So people, for example, in Canada who couldn't find a match here in Canada could find potentially another match elsewhere in the world. At BIEX Health, we want to build a society where graft failure is exceptionally rare and where people with an organ transplant can contribute to society at their full potential with minimum inconvenience and discomfort and interruption. If we let ourselves dream a little, we could imagine something similar to the World Marrow Donor Association, but for organ donation. In a few years, why couldn't the leading countries who are using AI for organ donation and transplantation create a world organ donor organization, so that someone with a rare profile, for example, you or even me, who can't find a match here in Canada, can have a better chance to find a match somewhere else in the world, for example, in Japan or New Zealand or India, who knows? Better chances of saving our lives. We are BIEX Health. We are developing solutions to improve organ donation and transplantation, and I thank you for your attention, and I'm open to questions.
Yes, we have time for one question.
Oh, okay.
We got a few back here. Who was first?
Hi, thank you for your speech, and this topic is really interesting to me, especially.
I'm sorry.
Can you hear me? Can you hear me?
Yes.
Yeah, better. So my question is more around the time component of this, right? Because the way I understand it is that usually when it comes to organ donation, it's on first come, first serve basis. Let's say the algorithm predicts someone to match with someone else optimally. How will you account for people who are ahead of you in the line?
Yes. Okay, that's a very interesting question, especially for people who don't know how this works. So basically, we're not Tinder. You can't just swipe, or the Inspired Minds apps, sorry for the organizers. We're not this kind of solution. Basically, we provide predictions for matchmaking. We do the predictions and provide the best matches based on those predictions. However, it can be possible that a less compatible match is good, but ahead in the list because they have priority lists. So this is where local rules come in the system and can override the proposal of the system. Does that answer a little more your question? Yes?
Very interesting topic, thank you. Question, in the opening remarks this morning, Professor Benjo explained the limitation of current AI technologies in dealing with odd settings or off statistical probabilities. That, on top of the fact that currently compatibility between donors and receivers is still a not perfect science. So what are the risks of adding an accurate AI layer on top of a science that is not currently perfect and mature and accurate? Thank you.
So, very interesting question also. The fact here is that we're dealing with health, human factors, and you will, because of the way body is built, you will never find 100% compatibility, even between twins. The idea here is to provide medical teams and patients some predictions that can help them see, okay, how long will I live with this potential organ? Could I live? What kind of side effects could I develop? What kind of adjustment to treatments could be done over the long run to make this organ more compatible? So it's a support tool here. It's not there to provide the perfect answer. In organ donation, you're always in a matter of trying to keep someone alive in the best situation you can. And sometimes, for urgent reasons, you have to get an organ that is less than compatible, but if you know what you can expect from it, so I said it was not Tinder, it's more like the weather app, if you want a comparable. Well, okay, I know what's coming, it's going to rain in 10 months. Okay, well, do I accept what is proposed to me or not? This is what we try to propose there.
Thank you. Thank you very much, Javi.
Thank you.